Planning to travel to Central Africa for work, business, or family? You need to stay informed about health risks. Ebola remains active in certain regions, and one wrong move can be life-threatening. Safety is non-negotiable. In this comprehensive 5-minute guide, I'll show you exactly how to protect yourself before, during, and after your trip. You will learn about current risk levels, critical vaccinations, and how to handle potential exposure safely. This advice is grounded in the latest 2026 recommendations from the World Health Organization and the CDC. Central Africa is a region of immense opportunity and culture, but geographic factors make it a hot spot for certain viruses. In 2026, increased regional travel means that localized health issues can move across borders faster than before. Ebola outbreaks are rare, but their speed and severity mean you cannot afford to be unprepared while on the ground. Transmission occurs through direct contact with infected fluids, often during high-risk events like funerals or animal contact. Early symptoms often mimic malaria or typhoid, leading to dangerous delays in diagnosis and treatment. Look out for sudden onset of fever, intense weakness, and muscle pain. These are the red flags you must monitor. Secondary symptoms can include gastrointestinal distress and skin rashes. Speed of care is the deciding factor for survival. Currently, countries like the DRC, Uganda, and Gabon require the highest level of vigilance for international travelers. Outbreaks can be localized. Always check the specific district-level advisories before moving between cities. Initial infection often comes from contact with infected wildlife, particularly fruit bats and non-human primates. Strictly avoid bushmeat. In medical settings, ensure all equipment is sterile and handled with extreme care. Your safety starts weeks before you board. Check the latest health bulletins at least 21 days before departure. If traveling to an active zone, the Ayurveda vaccine is the gold standard for protection. Consult your doctor early. While no vaccine is 100%, this significantly reduces the risk of severe disease if you are exposed. Remember, it takes about 10 days for the vaccine to provide maximum protection. Do not leave this for the last minute. In your kit, include medical-grade masks and gloves. They are essential if you find yourself in a healthcare setting. Confirm your insurance specifically covers emergency medical airlifts. Standard policies often exclude this for Ebola. When moving around, prefer private, well-maintained transport over crowded public options to minimize close contact. Choose accommodation with high hygiene standards and stick to bottled water and well-cooked foods. Wash your hands with soap and water or an alcohol-based sanitizer every time you enter a new environment. Traditional burial ceremonies are high-risk events. Respect local customs from a distance to ensure your safety. Travel with a local guide who understands the health landscape. They can help you navigate risk areas safely. A common mistake is ignoring small cuts. Always keep wounds covered and clean with disinfectant. Avoid handshakes or hugging in active outbreak zones. A friendly nod is a safer alternative for everyone. Create a digital and physical copy of your emergency contacts. This should be easily accessible at all times. If you feel sick, isolate immediately. Do not use public transport or visit crowded clinics. Contact your embassy and the local health hotline before moving. They will provide a safe path for medical review. After returning home, monitor your temperature for 21 days. This is the maximum incubation period for the virus. If you visit a clinic at home, tell them exactly where you traveled. This helps doctors act fast and protect others. By following these protocols, you aren't just protecting yourself, you are protecting your family and community back home. To recap, get vaccinated, stay sanitized, avoid contact with fluids, and monitor yourself for 21 days after return. Your health is the priority. Comment safe travel below if you found these tips helpful for your upcoming journey. Stay tuned for our next guide on the top 7 health risks for travelers in the coming year. Knowledge is power. Thank you for watching, and remember to travel smart and stay safe.